you doing? I am at my favourite place, HDU, and I'm having my Hickman line redressed, and then I'm going to go down to clinic and we're going to look at my blood results, and then we're going to talk about what the plan is for next week. I haven't had any pain per se, but the steroids have caused something called, I know the name for it now, Cushing syndrome, which is when basically your body produces too much cortisol, and it's the water retention in the face and the stomach, and that causes like quite a lot of pressure and pain. But anyways, I'll tell you a story. I woke up in the middle of the night, as I do sometimes, and just started Googling stuff, which isn't good. You probably shouldn't. But I did, and so I found this guy who vlogged his kind of cancer journey. So put some clips of, Isaac's going to put some clips of his videos in right now.
Hi, my name is Matt, and I'm currently undergoing treatment for the third time to cure my leukemia. Dad had a train to the hospital and went there this morning. I got there in outpatients. They did my blood pressure. They were all fine, all my blood was all fine, and my blood pressure was fine. So then I had to see my consultant, Dr. Ruben, and into my heart.
He was diagnosed in 2011, I think, then had 10 months of remission, then it came back, then he had another treatment, and then again, I think 10 months of remission, and then it came back again, as far as I understood. And so I found him because it was King's College CAR T-cell treatment, and he actually filmed his lumbar puncture. He filmed it, the procedure. You could see how painful it is because he's actually making quite a lot of noise. They also gave him Antinox. They never give me that for that. I don't know why. But anyways, he films it. You know, he goes on day leave, and it was interesting to me because kind of the same doctor that was treating him is going to be treating me in like the same facility.
Oh, is it Ruben Benjamin?
Yeah.
No way.
So he mentions him as well. And then in March, last video, the guy disappears. March of last year. No more videos, nothing. So I'm like, you know, he looked all right, and it looked like it was promising and stuff. And then I found this article, Tuesday, May 17th. And you'll see, like, he's a young guy, and he looked all right still. For some reason, he passed away. Just died. Which, when you're lying there in the middle of the night, finding that, it's just like, whoa. Francesca got really angry at me for Googling morbid stuff, but it literally is just, I'm curious because I'm waiting for so long, and it is what it is. So read like these reports on like CAR T-cell treatment and like the scientific studies and stuff, and it always starts with the first sentence. No, acute lymphoblastic leukemia, that's relapsed or refractory, the outlook is poor. And then it goes into why CAR T-cell treatment is better and blah blah blah.
These trousers as well.
So stylish.
Yeah.
Stormzy.
Bought myself some.
And some Yeezys. Are these new?
Yeah.
Ooh. The crepes on the board.
Check the crypto. Check.
Should we go to clinic?
Enjoy yourself. Well, they haven't redressed my dressing yet. So when they do that, we'll head to clinic.
And we'll go to clinic. Let's watch this get redressed.
Hello.
Hello.
How are you?
Good. How are you?
Onesie.
Stormzy trousers. Shut up.
Tell my man
man shut up.
No bone pain, so I feel good. Like in terms of I don't know if the results are back, but
We can't see any leukemia on the results we've got so far.
Okay.
So I don't think we need to do anything else this week.
Okay.
Yeah, I don't think you need to come back this week. So I think what we'll do is just see you once a week and try and get the steroids off altogether.
I found one of Ruben's patients actually. I was on YouTube. It's a little bit morbid because he was kind of documenting his journey.
Yeah,
And,
Ruben said that one patient had died.
Yeah.
That's probably him. Right.
It was it wasn't to do with his disease, I don't think. It was to do with transplant. And I think it was a second transplant.
Yeah, it was a second one.
And by the time you get to your second transplant, I mean, your body's been through so much.
And it was 6 years, I think, the whole.
It's called a 3x3 design. So they start off with 3 patients, and then if they're all fine, they go on to the next dose and they treat 3 patients. And if one of them gets a side effect, that's fine. But if 2 of them get a side effect, that's considered not fine, and then they go back to the previous dose. So they've escalated through various dose levels, and everybody's been fine. So they've now got to the next one up, so you'll get slightly more cells than the other people have had.
Okay.
Yeah.
Interesting.
Yeah,
Okay.
Perfect.
Beautiful.
Thank you.
Take this. I'll make the appointment.
Please.
Yeah.
1 week time.
Sounds good.
Oh,
What are they?
I feel good. Good news. My bloods are all almost optimal. The drug that they've given me has worked so well that I'm not going to need it, I think, before the big day. And we're still aiming for the beginning of May, so a couple more weeks. And so far, like, I'm starting to feel a bit better, so hopefully I can make a couple more appearances in the office before then. Until then, I have nothing more to say. I'm going to go home and just chill a little bit, and then I will see you soon.
have a lovely day.
You too. Enjoy
See you
yourself.
later.